So many have died in the past. Some have died already today. Some will still die tomorrow. If we don't listen, if we don't learn, if we don't try to put things together to prevent our mothers from dying, our mothers, our sisters, our daughters from dying. I'm your host, Dr. Festus Ossai, your life coach, the coordinator of your doctor and you. From the last publication of the World Health Organization, it is said that one in this part of the world, in Nigeria, for example, one out of every 22 women will die during either during pregnancy, delivery, or after delivery, what's called the postpartum period, or during what's called post-abortal complications. One out of every 22 women. Is that figure acceptable in a population of almost 200 million? If you extrapolate that, you can see that it's quite alarming. You say, look, I know, you must have seen. You've heard about a woman that died somewhere. Maybe a relation, maybe a friend, maybe somebody. And they came crying, oh, the woman died during delivery. As I was giving birth, she died. This had happened, this had happened. You must have heard. Or you must have been a direct victim. Don't you know that majority of those kind of situations would have been prevented? That death would have been prevented? Then listen to me. Listen to me. The world is enough for the wise. Let me tell you one thing. I want to look at, there are a lot of reasons why women can die during pregnancy. But I want to talk about one during pregnancy or during the labor or after labor, or even when there's a post-abortion crisis. I want to talk about in case of during pregnancy or during labor. What could happen? Even postpartum, what I call another case called postpartum stage. What will happen? Now, look at this. This is a balloon. The womb of a woman can be compared to a balloon. The balloon is what? Elastic. Okay? Now, this small balloon can be expanded to a certain size as this. When you blow it, it comes to this size. As small as this balloon can expand to. That is how the uterus, as small as my two fingers put together, can be as big to contain one baby, two baby, even 3 or 4 babies. Are you surprised? Yes, because it's what elastic, it can expand. But there's a limit to what the womb can do or the uterus can do. And that is why we need to know what to do safe, to do what we call safe practice, so we don't have to affect the integrity or the strength of the womb. Now, let me take, for example, this balloon. If I decide to put a pressure on this balloon, there's a certain pressure this balloon can carry. If I press, you see nothing is happening to the balloon. Are you seeing that? But if I increase the more than this, what happens? The balloon will burst. Now, what if maybe I decide to do a mark? I decide to put a scar here in this balloon. Let's say it's here now. The extent to which I can put the pressure on this balloon will not be as much as I would have done on it if this scar was not there. Or maybe the balloon have blown it more than how many times? Blow it, inflate the balloon, deflate, inflate the balloon. Each time I do it, the strength of the balloon goes down. That is what happens to the uterus or the womb of a woman. And that is why if you go to hospital, they know what to do to your baby to make sure your wife and your baby are safe. Unlike when you go to maternity home. So I will say, yes, now, the woman has been delivering babies for years and decades. But they will never tell you the complications that have arisen from their deliveries. They won't tell her. I see some of them, they come here. I see some of them. We shout at them, what have you done? And unfortunately, some of these well-educated people go to maternity homes to take the deliveries. I don't know. Is it the cost? I don't even know. Unsafe practice. The majority of them don't know their limits. Let me tell you, as a medical practitioner, that I know the limit of what I can do. If the case is bigger than me, I know what to do. I refer to another center, maybe the teaching hospital. Because we have what they call a referral system. And that's what the typical medical doctor will do whenever you go to his facility as a patient or when you go during delivery. But in maternity homes, it is when it is too late. That is when they remember to refer you. And before you know it again, the person is dead. A lot has happened. And these deaths are preventable. Now, I've explained to you the situation that will arise. Let's say now, this is a womb. A woman that has a scar. So we say, doctors, they like operation too much. It is safe. There are some certain things a doctor will look at you and say, look, madam, for so reasons, I think it will benefit you to go through a CS to save your life, and of course, to save the life of a baby. Okay? For some, they will look at you, they check you, they take a history, they examine you, they know exactly what to do. And there's a way a baby will be positioned. They will say, madam, it's better for you to go through a surgery, operation, rather than pushing the baby, because they don't want to endanger your life, and of course, endanger the life of the baby inside the womb. But when you go to some of these maternity homes, during labor, pregnancy, the labor is not progressing. Oh, what do? Let's put force. Let's try to force out the baby. Watch what they will do. Now, this is the womb itself. They'll be putting pressure. Oh, yeah, press. Madam, push. Press. Push. Press. Push. They are doing that. They do that. Sometimes they will sit on the tummy to make sure the force is more stronger. Now, what's going to happen? They push. Something has happened. Are you afraid? Are you worried? That's what happened to a woman. The womb has what? Ruptured, has torn like a paper, like what happened to the balloon right now. And the next thing, she starts bleeding. Sometimes they may be lucky if a hospital is close by, they rush the patient to the hospital. Of course, a surgery is finally done to save the life of the woman. Sometimes they're far away. The woman dies before she gets to her destination. But the question I ask you, this thing I just demonstrated is preventable if appropriate measures are taken from you, the patient, because they didn't force you to go to the maternity home or the traditional birth attendants. They didn't force you to go there. You have hospitals you can go to. If you think hospitals are expensive, or you think that is expensive, then watch out for burial to know that which one is much more expensive. Don't allow that woman that loves you to die. And for the women, don't endanger your life because you want to save cost of what you don't know about. Yes, people can deliver. Yes, people can even deliver at home without a complication. Yes, it can happen. But when you never can tell, sometimes a pregnant case that can get complications. A woman may come in labor. Normal labor may go on, but just a few minutes, the dynamics will change. And of course, the decision has to be taken, either to save the life of the woman or that of the baby. If it's in a maternity home, will they be able to do that? No, they are not trained with that skill to identify such things. That is why I will encourage you. Please take your wives to a hospital. You have private hospitals, you have government hospitals around you. A hospital is a facility that is run by a medical doctor. If it's not run by a medical doctor, it's not a hospital. Run away from there. If not, if a complication comes in, you are in for it. Don't say, if I had known. Some of them will come and be giving testimonies. The doctor said, I'll do operation. And I went, good. Miracles can happen. But please take care of your life so that you don't go to the other part of the world to explain to God how you lived your life carelessly. Or you lived your life carelessly, sorry. So that's what I want to try to tell you. Remember, don't allow them to massage your wife's tummy during pregnancy or during labor. Don't allow them to sit on your wife's tummy or to put too much pressure on the tummy. That tummy can burst open or can rupture. And of course, your wife can die. And you say, yes, I have to be harsh. If I have to be harsh to make sure that you're alive, I will do so. And I'll do it over and over again. If you know what to do in these centers, sometimes they put what they call hot drip. And hot drip, they say, way and manner, we doctors use it with all manner of caution, but they just pack about how many in the hot drip, believing that with that force that comes in, of course, the baby will come out. The baby will likely come out. Of course, what happens? The uterus will be torn because the pressure on the uterus at that time is much more than the uterus can carry. Mind you, I told you, the uterus is what? Elastic. So please, don't say you don't have money. Once your wife is pregnant, from there, start saving money for the pregnancy. Don't wait till when it's about to deliver before you start saving money. You have 9 good months to plan for your wife's delivery. If you save 5,000, 10 to 20 every month, that can take care of your wife. Whichever the eventuality will come up, to take care of it. Well, I'm not trying to threaten you, but I have to tell you the truth, the way it is. Play safe, stay safe, and live long. And you women too, don't allow your husband to risk your life. Or some of you will risk your life, even when your husband gives you money. You go to a maternity home or a to deliver. And when the complication comes, you will not be calling doctor. Doctor, please. Even some of you that register antenatal with us, you still go to maternity home or to deliver. When you like, what come to that day? Doctor, where are you? Where are you? What do I want to do? Please make our work easy for us. Register antenatal with hospitals. Doctors will take care of you. They will follow you all through, and they will know how far your delivery can go. Well, I'm your host once again, Dr. Festus Ossai. Remain blessed. Thank you very much.